What does a chest X-ray show if you have COPD? Imagine your lungs as balloons that help you breathe. When you have chronic obstructive pulmonary disease, or COPD, these balloons change shape and size. A chest X-ray is a simple picture that can show some of these changes. It helps doctors see what's happening inside your chest without surgery or invasive tests. One of the most common signs on a chest X-ray for someone with COPD is called hyperinflation. This means your lungs look larger than normal because they trap air. The damage to your lung tissue makes it harder for air to escape, so your lungs stay expanded even after you breathe out. This can make your chest look bigger or more stretched out on the X-ray. You might also see a flattened diaphragm. Normally, your diaphragm curves upward in a dome shape when you breathe. But with COPD, the lungs push down on the diaphragm, flattening it out. This change is a clear sign that your lungs are overinflated. Sometimes, the heart appears longer and more vertical because the lungs are hyperinflated and pushing it into an unusual position. Another feature is called the floating heart sign. When your lungs are very expanded, the bottom of your heart can seem to float above the flattened diaphragm, making it look like it's not resting on the chest wall as usual. The lung fields, which are the areas filled with air, may appear darker or more black on the X-ray because of trapped air. This is called hyperlucency. Your blood vessels in the lungs may look thinner or less prominent, a sign called vascular pruning. This happens because the damaged lung tissue reduces blood flow, making the vessels less visible. In some cases, especially with emphysema, you might see bullae. These are large air pockets that, from when lung tissue breaks down, they look like dark spots or holes in the upper parts of your lungs. Changes in your airways can sometimes be seen early on, but they are harder to spot. The size and shape of your heart can also change because of the overinflated lungs. It's important to remember that a chest X-ray alone can't confirm COPD. Sometimes, the X-ray looks normal, especially in mild cases or certain types of COPD like chronic bronchitis. Doctors usually combine the X-ray results with lung function tests called spirometry. These tests measure how much air you can breathe out and how fast. They help confirm the diagnosis and determine how severe your COPD is. Sometimes, a doctor might order a CORT scan, which gives a much clearer picture of your lungs. It can detect emphysema and other changes earlier and more accurately than a chest X-ray. So, while a chest X-ray can show signs of COPD like hyperinflation, flattened diaphragm, and bullae, it's just one piece of the puzzle. It helps your doctor understand what's happening inside your lungs and guides the next steps in your care.